Most people think diabetes can only be detected through a blood test. You visit a doctor, get your reports, and that's when you finally find out. And honestly, I understand why people believe that. For years, my own patients used to tell me the same thing. My name is Dr. Valina, and I've been practicing medicine for over 2 decades. And what I've consistently seen, week after week, is this. Your body doesn't wait for a lab report to warn you. It starts giving signals much earlier. And surprisingly, one of the first places those signals show up is your feet. The reason I'm making this video is simple. I've seen too many patients come into my clinic, or even worse, the emergency room, who had warning signs for months, sometimes years, but never realized what they were looking at. Today, that changes. Just recently, I met a 67-year-old patient. Retired, active, felt completely fine. He came in for a routine checkup, but before running any tests, I asked him a simple question about his feet. He said, "My feet have felt a little numb lately. I thought it was just age." But it wasn't. He already had 4 of the 9 warning signs I'm about to show you. And when his test results came back, his fasting blood sugar was 214. He had type 2 diabetes and didn't even know it for over 2 years. That's exactly why this video matters, because the signs were already there, on his feet, just like they are on millions of people right now. But most people don't recognize them. In this video, I'll walk you through 9 warning signs. For each one, I'll explain what people usually think it is, what's actually happening inside the body, and one simple daily habit that can help protect you. According to health data, millions of people are living with diabetes without even knowing it. And during that time, the condition quietly affects nerves, vision, kidneys. And yes, the feet. The good news? A simple test can detect it early. But before that, you need to know what to look for. So let's start with the first sign. This is something almost everyone has experienced, and almost everyone ignores. That tingling feeling, numbness, that pins and needles sensation in your feet. Most people say, "My foot just fell asleep. I was sitting wrong." And yes, occasionally that's normal. But here's the real question I ask my patients. Is this happening again and again without any clear reason? Because if it is, then something deeper may be going on. Frequent tingling or numbness in the feet, medically known as peripheral neuropathy, is often one of the earliest signs of elevated blood sugar. What's happening inside your body is this. Excess sugar in your bloodstream slowly begins damaging your nerves. It doesn't happen overnight. It's gradual, which is exactly why it goes unnoticed. Think of your nerves like electrical wires. Each wire has a protective coating that allows signals to travel smoothly. But when blood sugar stays high for long periods, it starts damaging that protective layer, little by little. The wire still works, but the signals become unclear. And that confusion in signals is what you feel as tingling. In fact, nerve damage is one of the most common complications of diabetes, and it almost always begins in the feet, which means right now, millions of people are feeling this exact sensation and simply ignoring it. Don't be one of those people who ignore these signs. One simple recommendation I give almost every patient over 60 is this. Walk for 20 to 30 minutes every single day. Not running, not intense workouts, just a steady walk. Because movement improves blood flow to your feet and helps protect those delicate nerve endings. And just as important, start cutting down added sugar today. Not next week, not next month. Today. Now let's talk about sign number 2. This is the one many patients say is the most uncomfortable because it doesn't bother them during the day. It shows up at night, when you're lying in bed, trying to sleep, and there's nothing to distract you from it. A lot of people assume it's just fatigue, heat, or standing too long. And sometimes it is. But when someone tells me their feet feel like they're burning, especially at night, I pay very close attention. A burning sensation in the soles of your feet is one of the early warning signs of diabetic nerve damage. Here's what's really happening. High blood sugar starts damaging the nerves in your feet, and those damaged nerves begin sending the wrong signals to your brain. Your brain thinks your foot is hot, even when nothing is actually touching it. It's a signal problem. Think of it like a fire alarm with a faulty sensor. There's no fire, but the alarm keeps going off. That's exactly what your nervous system is doing. The burning sensation isn't coming from outside your body. It's coming from inside damaged nerve tissue. And in many cases, this symptom appears years before someone is officially diagnosed with type 2 diabetes. So what can you do? 2 simple habits. First, stay hydrated. Drink enough water throughout the day. Proper hydration helps your body flush out excess glucose and supports nerve health. Second, increase fiber in your meals. Foods like vegetables, lentils, and oats slow down how quickly sugar enters your bloodstream. And that's exactly what your nerves need. Less sudden spikes, more stability. Now let's move to sign number 3. And this one is serious. This is where things stop being uncomfortable and start becoming dangerous. This is also one of the biggest reasons people end up in the emergency room. I've had patients say, I got a small blister from my shoe weeks ago, but it's still not healing. They waited. They assumed it would fix itself. And normally, small wounds do heal, but not when blood sugar is high. When glucose levels stay elevated, your body's ability to heal slows down significantly. Blood vessels, especially the tiny ones in your feet, start to narrow and stiffen. That means oxygen, nutrients, and immune cells can't reach the wound properly. So the wound stays open, slow to heal, and vulnerable to infection. Think of it like trying to water a garden with a hose that's bent in the middle. The water is there, but it's not reaching where it needs to go. That's exactly what's happening in your body. And a wound that doesn't heal can quickly turn into something much more serious. So here's a simple habit you need to start today. After your shower, take a minute to check your feet carefully. Look between your toes. Check your heels. If you notice any cut, blister, or broken skin, clean it, protect it, and monitor it. And if it doesn't improve within 48 hours, don't wait. Get it checked. Now let's talk about sign number 4. This one is easy to miss. It's right in front of you. But most people never connect it to blood sugar. Some people notice their feet starting to look darker or slightly reddish, and they assume it's sun exposure or just natural skin tone. But sometimes it's something deeper. And yes, that might be true in some cases. But there's a very specific pattern of discoloration, especially around the ankles, that I pay close attention to when evaluating blood sugar risk. When blood sugar stays high for a long time, it starts affecting circulation. The small blood vessels in your legs and feet begin to narrow, which means less oxygen-rich blood reaches those areas. As a result, the skin starts to change color. You might notice darkening, a deep red tone, or even a slight bluish tint around your ankles. This isn't just a cosmetic issue. It's your body signaling that blood flow isn't reaching where it needs to. In some people, the skin in those areas also becomes thinner and more fragile. That's another sign the tissue isn't being properly nourished. I usually explain it like this. Think of your blood as a delivery system carrying oxygen and nutrients. Your feet are at the very end of that delivery route, the farthest point from your heart. Now imagine the roads getting narrower because of damaged blood vessels. Deliveries start arriving late or not at all. And when your skin doesn't get enough oxygen, it changes color. That's a visible warning sign your body is giving you. Research has shown that these types of skin changes can appear well before diabetes is officially diagnosed, sometimes more than a year earlier. So what can you do? Start simple. Spend just 5 minutes every morning doing ankle circles, toe raises, or light calf stretches. Even small movements help improve circulation. And if movement is difficult, simply elevating your feet while sitting can also help improve blood flow. Now let's move to sign number 5. This one surprises a lot of people because it looks harmless. Cracked heels. Most patients tell me, my heels crack every winter. It's just dry skin. And yes, that's very common. But if your heels are severely cracked, even in warmer months, or if no amount of moisturizer seems to work, that's something different. What's happening here is deeper than just dry skin. Diabetes can damage the autonomic nerves, the nerves responsible for automatic functions like sweating and skin moisture. When these nerves are affected, your sweat glands don't function properly. Your feet lose moisture from the inside out. So even if you apply lotion, you're only treating the surface, not the root cause. Think of your skin like a wall that needs to stay sealed. When those nerves are damaged, it's like the cement between bricks starts breaking down. Cracks begin to form, and those cracks aren't just a cosmetic issue. They can become entry points for bacteria and infection. And when circulation is already poor, even a small infection can become serious very quickly. I've seen patients come in with deep heel cracks that were actually bleeding, and they had been trying lotions for years with no real improvement. That's not just a skin issue, that's a nerve issue. One simple habit that can help. Moisturize your feet every night before bed. Use a good quality lotion or even natural oils like coconut oil, but avoid applying anything between your toes. That area traps moisture and can lead to fungal infections. And just like before, hydration matters. Drinking enough water daily supports your skin from the inside, not just the outside. Now, before we go further, I want to ask you something. Have you noticed any of these signs, even one, in yourself or someone close to you? A parent, a spouse, a sibling? If yes, take a second and acknowledge it. Because awareness is the first step toward prevention. And if you're finding this helpful, make sure you stay with me, because the next signs are even more important. It only takes 1 second, and it helps this video reach more people who actually need this information. All right, let's keep going. Sign number 6. And this one is more serious than most people think, because it's not just about your feet. It can also be connected to what's happening inside your kidneys. Most people tell me something like this: I sit all day, or I stand a lot at work. That's why my feet swell. And yes, occasional swelling can happen, but if your feet and ankles stay swollen regularly and you notice deep sock marks by the end of the day, that's different. That's something you shouldn't ignore. Here's what's really happening. High blood sugar over time starts affecting your kidneys, and your kidneys are responsible for managing fluid balance in your body. When they're not working properly, fluid starts building up, especially in the lowest parts of your body, your feet and ankles. This condition is called edema. Think of your kidneys like a filtration system. Every drop of blood passes through them to get cleaned. But when that system is damaged, things start backing up, and that extra fluid has nowhere to go, so gravity pulls it downward into your feet. You might even press your finger into the swollen area and notice the dent stays for a few seconds. That's called pitting edema, and it's a warning sign. What can you do? Start simple. Whenever you're resting, elevate your feet slightly. Even a pillow helps. This supports better fluid movement and reduce your salt intake. Too much sodium makes your body hold on to water, which makes swelling worse. Also, check labels. A lot of packaged foods contain more salt than you realize. And if this swelling is new or getting worse, don't ignore it. Bring it up with your doctor. Now let's move to sign number 7. This is one of the most commonly misunderstood signs, especially in men. I hear this all the time. I've been taking painkillers for my foot pain. I thought it was arthritis. And sometimes that's true, but not always, because in many cases, this pain is coming from nerve damage, not joints or muscles. When high blood sugar damages nerves, they don't always go numb. Sometimes they do the opposite. They become overactive. Instead of silence, they send random intense pain signals to your brain. People describe it as stabbing pain, electric shocks, or a burning needle sensation in the foot, and it often gets worse at night when everything is quiet. Here's a simple way to understand it. Imagine a car alarm that's damaged. No one is touching the car, but the alarm keeps going off. That's what damaged nerves do. They send signals even when nothing is actually wrong on the outside. The pain feels real because it is real, but the source is nerve dysfunction, not injury. And painkillers like ibuprofen don't fix that. They only hide the signal, and hiding signals your body is sending is not the solution. So, what helps? Start your morning with 5 minutes of gentle movement before getting out of bed. Flex your feet, rotate your ankles, stretch your toes, get blood flowing early, and at night give your feet a light massage. Slow, circular motions on the sole and around the ankle. This improves circulation and helps calm the nerves. Your nerves will thank you for it. Now let's move to sign number 8. This is the one that tells me how far things have progressed. When I see this in a patient, I know we're no longer in the early stages. And almost every time, the first thing I hear is, "I've always had cold feet." They laugh it off. They think it's normal. But then I ask a simple question. Are your feet cold even in the summer? Are they cold even under blankets? That's when it becomes serious. Because feet that stay cold regardless of temperature are not about comfort. They're about circulation. When blood sugar remains high over time, blood vessels start to narrow and stiffen. That means warm, oxygen-rich blood isn't reaching your feet properly. So even if your body feels warm, your feet stay cold. Think of it like a heating system in a house. Warm air is being produced, but if the pipes are narrowed, the heat never reaches the far rooms. Your feet are that far room. And when they stay cold, it's a signal that blood flow is restricted. What can you do? Movement is key. A daily walk, even 20 to 30 minutes, can make a real difference. Not a slow stroll, but a steady, purposeful walk. If 30 minutes feels like too much, start with 10. The important thing is consistency, because movement helps push blood back into those smaller vessels and improves circulation over time. Now let's talk about sign number 9. This is the one almost nobody notices, but once you see it, you can't ignore it. Hair loss on your feet and lower legs. Most people don't even realize it's happening, but during exams, I often see areas where hair is noticeably thinner or completely gone. And when I point it out, patients are surprised. Hair growth depends on blood flow. Hair follicles need oxygen and nutrients to function. When circulation is reduced, those follicles slowly stop working, and over time, hair stops growing. It doesn't happen overnight. It's gradual, which is exactly why most people miss it. Think of it like plants in a garden. If the water supply is reduced, the plants don't die immediately. They just stop growing. That's exactly what's happening here. And it's a visible sign that circulation has been compromised for a long time. So here's something simple you can do right after this video. Take a look at your lower legs and the top of your feet. If you notice less hair compared to the rest of your leg, or no hair at all, don't ignore it. It's worth getting your blood sugar checked. Now, we've covered a lot today. 9 different signs, 9 early warnings your body may be giving you. And here's the truth. One of the hardest parts of this is seeing people who had these signs for years, but didn't know what they meant. Not because they didn't care, but because no one explained it to them. Now you know. So here's one simple step. Tonight, before you go to bed, take 30 seconds. Look at your feet. Check the skin. Look between your toes. Notice any numbness or unusual changes. Just 30 seconds, because catching this early can make a huge difference. In many cases, simple steps like better diet, daily movement, and early medical advice can prevent serious complications. You've worked hard for your health and your independence. Don't let something manageable take that away, just because it went unnoticed. If this helped you, share it with someone who needs to hear it. A parent, a friend, a family member. Sometimes awareness is the best form of protection. And if you want more videos like this, stay connected, because there's always more your body is trying to tell you. You just need to know how to read the signs.